Hi, my name is Zaina Kadogan, and I am in the SOCI 3670 course, and Professor Sean Babel. My presentation will be on sports and health, subtitle Active Canadians, Men and Women. And so, in 1998, Canadian Heritage Subcommittee report titled Sport in Canada, Everybody's Business indicated that the mass participation in sports was identified as one of the best ways to achieve our social and economic objectives. There was a 10% decrease of inactive Canadians in Canada during 1998, that study, as well as a $5 billion savings in healthcare costs. That was because if there was a decrease in the amount of people being inactive, then less money was being spent on programs and health initiative to prevent inactivity. Also, there was a gradual increase in overweight and obesity trends since the 1990s. For men, obesity rates increased with men who were associated with money, and for women, the obesity rates also increased for women who were associated with lower income rates. Low female participation was treated like a health issue. Inactive females are at higher risk of cardiovascular and other diseases, cancer, hypertension, and much more. Females pay the price for thinness. They are pressured by a lot of societal factors, family, peer, and media pressures on girls and women to achieve an ultra thin image. You see this on TV and on the media all the time. Because the ultra thin body image is seen as the attractive image. So, because there's so much pressure on women and females, it creates a dangerous eating behaviors. There's a correlation between physical exercise and prevention of many chronic diseases. There's many health problems such as pain and suffering, chronic and life-threatening diseases, smoke and type stroke and type 2 diabetes. Also, regular physical activity is very essential for girls and women, particularly for their physical and psychological health and well being. All children require physical activity to ensure cardiovascular benefits for their bones, for their early development, for them to have healthy weight, and long term health promotion. Also, baby boomers are had a great influence on Canadian society in 1996. The impact on the Canadian pension plan and the Canadian healthcare system. This has been a subject for quite a while, where the boomer generation has been more active than previous generations. So the more recent boomers tend to be more active than the boomers from before. Uh, the children now are more requiring facilities in which they can access to be more active and so forth. In 1998, that study was done. Also, encouraging physical activity. Fitness information at work. So 32% of working Canadians report that their employers use bulletin boards, such as newsletters and so forth, to promote health and fitness in the workplace. And this is according to Statistics Canada. Those working in finance and service industries are more likely than those in manufacturing and trade to access these physical activities, programs, and seminars at work. Again, according to Statistics Canada, 25 to 32% of Canadians report their employers post info. And again, active living, sorry, is seen as a culture, whereas it seeks support from the top level management to provide resources. And active living definitely could go beyond the workplace, where individuals may take part in community active involvement or physical activity or events. The use of time after school is very important in children's physical activity. Paying attention to different programs that they may have access to, after school programs or outside the curricular programs. Also, local opportunities, maybe nearby recreational facilities. Parental involvement and children's sport preferences. So, again, being an active parent, an active child involves an active parent, because the parent definitely has to be involved and supportive. Also, support of active aging. It is important to plan for healthy aging because you can make the most out of later life. Control your decisions and maintain health and independence and reduce healthcare costs. There are some support initiatives in place at the moment. For instance, in June 2011 in British Columbia, physicians were provided with additional tools to help patients who belong to one of the at-risk populations. Either the at-risk individuals were considered either smokers, unhealthy individuals, people with eating disabilities, or physically inactive individuals, obese, and also others individuals who may have been risk of health complications such as chronic disease. And basically, these individuals would get help in making long-term plans. And again, this is an initiative from 2011 Active Aging Symposium Report, Planning for Healthy Aging. Again, according to Statistics Canada, being active is considered using 3 or more kilocalories, which is basically walking for an hour a day or jogging for 20 minutes a day. And according to Statistics Canada, what they considered moderate active is using less than 1.5 kilocalories per kilogram of body weight per day, which is walking less than half an hour per day. So moderate active is pretty much half of being active or less. Based on this, 27% of Canadians were active during their leisure time. Also, based on those same studies, 25% of Canadians were moderately active. And in total, 52% of people 12 and under in Canada were moderately active during 2005. So that concludes my presentation on active Canadians.